Morning, North Dakota. Welcome, everybody. Thank you for being those that are here from the media in person. Thanks for everybody who's tuning in today. We've got a great set of presenters for today's program, including Kirby Kruger, who's the director of the North Dakota Department of Health Division of Disease Control, Molly Howell, who you've heard from before, who's doing the great work as the head of our immunization program manager, and she'll have some guests that she's going to introduce. Remotely, we're going to have Dr. Josh Wynne, who's our State of North Dakota Chief Health Strategist, as a role during COVID. He's also the Dean of the UND School of Medicine and Health Sciences, and then Dr. Joan, Connell, Field Medical Officer from the North Dakota Department of Health. By and large today, we've got a lot of really good news, and this is good news that should be celebrated by all North Dakotans because it's the work that you've been doing, the individual responsibility you've shown, the actions you've taken to slow the spread that are showing up in our numbers and giving us encouragement. I think Winston Churchill famously said one time when he was talking about World War II that this wasn't the end, but it was the beginning of the end. And I think when you hear the positive news that we have today across multiple areas, then you're going to understand that we can see a light at the end of the tunnel in terms of the end of the pandemic. And part of that is because of great work that all of you are doing, but it's also because we've got new tools in our toolkit. And today we're going to talk about those three powerful new tools that we didn't have 9 months ago. We didn't even have them really 2 months ago, but we have them today. And those three things, of course, we're going to talk about the vaccine and how that's going to be a super powerful tool in helping us end that. The second one is in an effort to reduce the mortality and save lives, a broader and more proactive use of the therapeutic solutions that are now available to help us save lives of those people that do become infected. And then the last thing to help us break the transmission chain is to more broadly use the Binax Now or the rapid testing in a way to not only help us get through the holiday season, but to help us get our kids back in school and keep our businesses open and running. And so we've got some very positive things happening. For us to kick off this morning, I want to start talking about some of the broadly some of these things that we're seeing, and of course, one of them which you've received news this week was and a lot of attention as it should, because it was a historic week where the newly arrived COVID-19 vaccine from Pfizer being the first, and Moderna on its way. Expected to be here shortly. There's a second vaccine. But as you've read here, that healthcare workers from Stanford and CHI were among the first to receive the vaccine in Bismarck. Today, we've got two individuals that are going to be ready to receive their first doses of a 2-dose vaccine. And Molly Hall will provide an update on vaccine distribution, prioritization, and supply. And when we talk about the expanded use of the low-cost, rapid, and highly effective at identifying people who are infectious, the Binax Now tests, these are great because they give you a positive when someone's got a high viral load. We can identify people who are asymptomatic and pull them out of the transmission chain, and this is a way, low-cost, highly effective, quick way to break that transmission chain. And we have Dr. Josh Wynne will be giving the update on that. And then the third is this all of the exciting new therapeutics, which truly can be not only life-saving, but they have are demonstrating to have the potential to significantly reduce the need for hospitalization. So if you can reduce hospitalizations, that's great news for anyone who does not have COVID, but might be needing the highest level of medical care for stroke or heart attack or cancer or trauma, because again, we're managing our healthcare capacity for all all disease tracks, not just for COVID. But Dr. Joan Connell will talk about that. And again, none of these tools, which are all three of these tools are super exciting, but it does not reduce the need for us to continue to be vigilant in terms of physically distancing, wearing masks, washing our hands, avoiding large gatherings, particularly as the holidays coming up, because transmission can occur in your home, around the dining room table, with family members as easily as it can at some other place like a work or in public. But there's two things that we know now that the virus doesn't like. The virus does not like ventilation. And we know from all the studies that there's less transmission when people are doing the same thing, say dining outside versus dining inside. But we're in a position in North Dakota where some of our outdoor activities are perhaps more limited, but still encourage people to think about avoiding places with poor ventilation and doing whatever you can to increase the ventilation where you are. The second thing, the virus cannot survive in places where there's distance between humans, so it doesn't like distance. So again, as you head into the holidays, be aware and be alert that at places that have got large crowds of people unmasked in poorly ventilated locations, that should set an alarm for you that that's an area where there's much more likely to be transmission. And if you're in some place where you've got great ventilation and distance, you're likely quite safe. So this is the safety factors vary, but you as an individual can make the choices of how you want to spend your holidays to make sure that you're protecting yourself, your family, your family members, those that are vulnerable, our healthcare workers and others in the community. But as you can see, we've got a full agenda today, but let's jump right into the numbers. In the past 7 days, it's fun to report a low number in terms of new cases. It's still high compared to where we were, of course, in the earlier parts of the pandemic, but it's nice to be on the downside of the slope. 2,605 new cases, but 4,020 newly recovered. And so that our active cases continue to drop. They dropped 108 from yesterday, but they dropped significantly over the past week, and significantly from our peak in mid-November. Our percent positivity rate in terms of new cases versus those that were testing was 5.8%. Our testing levels, as you can see here, down a little bit. We want to encourage people to continue to seek testing as appropriate, know your status, particularly heading into the holidays. We have extra capacity for testing, both at PCR testing and the Binex testing. And just because our numbers are dropping doesn't mean that there aren't asymptomatic spreaders out there. So it's important for everyone to think about how testing can help them get through the holidays and protect their loved ones. We now have completed over 1,242,000 tests of North Dakotans, and many of those have been repeat tests, particularly people in long-term care and healthcare workers. But now nearly 50% of North Dakotans have been tested at least one time. Looking at hospitalizations due to COVID, we've got some good news, and some of it is good news because of the actual progress in the last few weeks, and some of the other elements of good news come from data cleanup. Which resulted in that data cleanup resulted in even a further drop. And so we're down today at 160. We're down from where we reported Monday at 117. When we were doing the data cleanup yesterday, we held that number at 277 to make sure we had the clean data. And so we're down from 277 to 160, and that's a decrease of 124 from last week on December 9th, but it's a 53% decrease from our peak that we had back in November, and you can see that all of these numbers have been restated back to their actual days of discharge. So this curve looks a little bit different, but this is the current information. So all of the drop that we're seeing from Monday today should not be viewed as a one-day decrease. Rather, it's a product of a data quality check that our Department of Health conducted, because there was some restatement going back, I think one in September, some in October, more in November, and some are the last 2 weeks. But because data is so important to what we're doing, Kirby Kruger, who's the director of the Department of Health's Disease Control, is going to come up and talk a little bit about that. Kirby, thanks for joining us.
Thank you, Governor Burgum. As the governor mentioned today, the Department of Health is reporting a net decrease of hospitalizations of 117 individuals compared to our last report that was on our website. Hospitalizations in our state have fallen rapidly in the past few weeks, and that's good news. And while much of this difference reflects newly discharged cases, part of this drop reflects a recent quality control effort as caseworkers and team members caught up with these changes following our recent surge of cases in October and November. Of the 146 hospitalizations whose status was changed from current to discharged, 74 had been discharged in the past 2 weeks, and the remainder were discharged prior to December 1st. This was due to a variety of factors, including case managers catching up with follow-up after the surge of cases, lags in reporting between when patients were actually discharged from facilities to when the health department was notified, and of the discharges through the health information network and the data coming in through the health information network. And then there's some data quality issues in which there was some inconsistent data entry that was occurring. To fix this issue, and in the future, the team will be working more actively with facilities to ensure that information is up to date and accurate, and will continue to check the Health Information Network daily for hospitalization information. The Department of Health, the Governor's Office, and others continue to be in regular communication with hospitals at least every other day, and we've heard in those conversations over the past weeks that they continue to be under pressure and many are still experiencing some staffing issues. I think it's important that we just remain vigilant in this pandemic, and we thank you for taking steps that help us continue these positive trends. And I thank the Governor for his time. Thank you, Governor.
Thank you, Kirby, and thank your team also for being so dedicated to high-quality data, because it's key to what we're doing. So appreciate that. But again, it's good news that we had such a significant drop in hospitalizations, but again, we're managing hospital capacity for all disease tracks, not just COVID, and we know that we continue to have some staffing challenges, and that's why the three things that we're going to be talking about today that give us hope across broader surveillance testing, low cost, rapid results there, the therapeutics and the vaccine all matter, because all three of those will play into helping us reduce the need for hospital capacity. So this is a multi-pronged effort, but with the mitigation efforts that we have put in place, and with the great efforts of North Dakotans, we are headed in the right direction. And again, as we head into the holidays, we have probably today a point for a little optimism, whether it's each of the three things we're going to talk about today, but we can have a lot of optimism that 2021 is going to be better and different than 2020 was, because of the new tools that we have, and because of the great work that North Dakotans are doing to help slow the spread of the virus. One of the things that we're going to take a look at next is some more numbers on regional cases. I think we can see, again, we talked about how we were in the middle of a COVID storm that we were in, and of course running from the Great Lakes to the Rocky Mountains, and there was a high prevalence of cases across this area, close to 60,000 cases in Illinois, 27,000 in Wisconsin, 25,000 in Minnesota, and 4,600 approximately in both Montana and South Dakota. And of course, some of those rates vary because of different levels of testing. North Dakota is, as has been throughout this, is among the leaders of testing of all the states. So when you do more testing, we're going to have more cases. So I think it's important also to look at the positivity rate. And when we look at the positivity rate, you can see that North Dakota has the lowest positivity rate of any of the upper Plains and Rocky Mountain and Great Lakes states that were involved in this storm. And we're focusing on this region because this is a region where where largely the storm is starting to go on the decline. We're seeing increases in over 40 states across the nation. So we're fortunate to be among those. We're seeing a decline. But in terms of percent positivity, some of the states doing less testing and perhaps only testing symptomatic individuals, which could work if it was the flu where everybody's got symptoms. But with COVID, where spreaders can have no symptoms, it's important to do broader testing because you have to break the chain of the spread by isolating those people who have no symptoms whatsoever. This is the key to what we're doing with Binex. And so with a 7% rate here, it's on a great downward trend, lowest in the region. Again, this is something that North Dakotans can all feel great about in terms of what they're doing. But there is still high prevalence around us. When you look at states in the region that are in the 30, 40, and even 50% plus range in terms of positivity rate, I'm glad that that's a territory that North Dakota never entered. When we take a look at the next slide on the statewide positivity rate, again, great downward trend, down to 7.3. We would love to, super encouraged by the direction of this thing. But as we talked about in the early days of this thing, as we want to think about how do we move towards less mitigation, we need to be thinking collectively of how can we get this number down over 5%, down under 5%, and deal with the holidays. If we can do those things simultaneously, that will be another major victory for us. So again, thanks to all North Dakotans for your part in this trend line. When we take a look at the next slide in terms of recoveries, and which is great because again, we've had 84,535 individuals recovery. We're still working on the data, but it's likely that we are the recovery per capita champions. Just like we were highlighted as being cases per capita, we also will be the recoveries per capita, and that both of those numbers are a reflection of the testing that we've seen. But the one thing that is very sad to report that again over the last week we have had 115 more deaths in our state, including 27 today. And so this is relates to the reason why we need to be cautious over the holidays, why we have to continue to be thoughtful and respectful and compassionate about those people that have underlying conditions where this disease is cruel, and again, protecting those folks that are in congregate care where this can spread so rapidly. The vast majority of the deaths that we've had, of the nearly 2,000 deaths, have occurred in long-term care settings, and so again, that's why we want to make sure that we're doing everything we can to not just have low numbers statewide, but to eradicate the presence of COVID within our long-term care facilities. And that's why it's important that long-term care health workers were listed among those that can be in the front of the line for receiving the vaccine, because if we can protect those healthcare workers, we can protect those that are living in congregate care. But as always, from the First Lady and myself and Lieutenant Governor Brent Sanford, our hearts go out to the family and friends of all those who've lost loved ones during COVID-19. When we take a look at cases statewide, the North Dakota has got, every county has got at least 2 active cases, so we continue to have the known presence of this disease everywhere across the state, but case counts have decreased, and for the first time in a long time, we've got no counties that have a case count above 1,000. We still tend to see, more cases in our more populous counties. Cass and Burley are among the largest, and Burley and Morton, together as sort of one metro area, represent an area where we still have a lot of active cases. But other counties that are still above 100 include Grand Forks with 223, Ward with 193, Stutzman with 122, Williams with 119, and Stark with 109, and Richland at 100. When we look at the cases per 10,000, we get a little bit of a different look because this is the prevalence per population. And again, that prior chart may cause someone in a rural area to say, gee, we don't have to worry about it. But again, when we look at cases per population, we can see that in the north central part of the state right now, where it's darker up there, Rolette, Towner, Pierce, Benson, Ramsey is an area of concern. And then Logan County and just south of Stutzman County, and then of course Sioux County, areas of higher prevalence. And again, so we want to continue to work with local public health and with the leaders in those communities to make sure that we're seeing the numbers drop in those more rural areas as well. Next topic has to do with the vaccine. And this is a historic week for the world and for the nation and for North Dakota, with the first doses of the vaccine being administered. And I want to again help people understand we take many things for granted. Sometimes living in the abundant society that we do of the United States of America, but this is a credit to both science and technology, but it's also a credit to the administration the current administration in D.C. that a safe and highly effective vaccine is already available. Last spring, when we were entering this effort, there was a call out from many governors saying if we're going to spend trillions of dollars in fighting COVID, and if we're going to spend trillions of dollars in aid, let's make sure we also have the equivalent of what during World War II was called the Manhattan Project, which is to build the atomic weapons. And so we said, what would be the tool that we could have to help us eradicate this? It's a vaccine, and Project Warp Speed was born, and billions of dollars have been invested in private-public partnerships to help drive towards solution. There are many viable vaccine candidates. The reason why the speed can occur is in part because of the genome sequencing work that's been done and advances in just basic science in the last 20 years allowed people to very quickly come up with an effective target which to build the vaccine. And then there was no corners cut in terms of clinical safety. We had a call last Saturday with the FDA leaders and all the governors. They went through, I'm probably the fourth or fifth presentation I've had in the last 2 months, highlighting the fact that there was absolutely no changes on clinical safety. In fact, the size of the clinical human trials for these vaccines was in some cases 2 to 3 times larger than before. Typically, it might be 10,000 people in a study. This was 30,000 plus. And so there have been, again, absolutely no shortcuts relative to clinical safety. Well, how do you get something out faster? You cut all the bureaucratic red tape that doesn't have anything to do with clinical safety. And so with more resources, financial resources, logistic resources put towards producing a vaccine in parallel with the studies, with the work that's been done, the pre-planning with the states like North Dakota, who is one of 4 pilot programs, allowed the day immediately after the FDA approval of Pfizer, the first one out the gate, shipments began, received those in North Dakota. They're coming out in quantities that are going to be increasing. And so again, the work that's been done on the de-risking the financial risk and improving the logistics is where the time shortage has come from. Why is this important? When we were on a call on Monday with the Vice President and others, governors from around the nation, and I was called on for an update, which happy to share all the good news, but relative to the vaccine, which I shared with the White House Coronavirus Task Force, this is historic, not just because we are getting a vaccine out in record time. It's because the understanding that we can have safety at the same time we can have speed, and this is probably going to be a change that will affect the release of all kinds of life-saving drugs for all different kinds of categories in the future, not just a COVID vaccine, but if we can take drug release releases from efficacy to release from 5 or 6 years down to less than a year. Think of the impact that's going to have on citizens and the world because that truly will be life-saving. So I think that some of the process changes are going to be as important in the long run as the fact that we've got this life-saving vaccine right now. So here in North Dakota, we've had people working on distribution and prioritization for months, and I want to thank the dozens of members of Team ND, local public health partners from across North Dakota who have poured hundreds of hours into preparing for the moment that we received this week, but no one has put more time into that and provided more leadership than Molly Howell, and Molly's the Immunization Program Director for the Department of Health. She's been at the helm of this effort from the beginning, and she's going to walk us through the next section of our program relating to the vaccine. So, Molly, great to have you here.
Thank you, Governor Burgum, and I am so excited to be here, especially this week, because we have COVID vaccine in North Dakota. I've been really honored to be a part of this effort. I've been in immunizations for almost 18 years right now, so I think we're finally going to get to see real time the benefits of vaccines. I don't think a lot of people were around when polio was going around and a vaccine was first developed by polio. Some people might remember the immediate impacts of that vaccine, but I think we're about to see the benefits of vaccine real time in North Dakota and hopefully across the world. So North Dakota did receive 6,825 doses of the Pfizer vaccine this week. Shipments came in on Monday and Tuesday. Some of those shipments went directly to our referral hospitals. Other shipments came to our warehouse and were broken down into smaller quantities and then redistributed. As of last night, 831 doses have been administered in North Dakota. And I do want to mention that the FDA did approve or authorize this vaccine late Friday night, and it was authorized for individuals 16 and older. And so previously we had thought it would just be 18 and older, but clinical trials did include 16 and 17-year-olds. So with parental consent, 16 and 17-year-olds can also be vaccinated when their priority group is up. And then over the weekend, the Federal Advisory Committee on Immunization Practices met and made recommendations around the use of the Pfizer COVID vaccine in the United States. And I just want to highlight some of the recommendations because they address a lot of the questions that people have had around COVID-19 vaccine. And so there are certain people who should not receive COVID-19 vaccine. If you have a history of a severe allergic reaction, anaphylaxis to a previous vaccine or injectable therapy, then you should not be vaccinated for COVID-19. And that is the only group who should absolutely permanently be contraindicated to receiving COVID-19 vaccines. We get this question probably most often: should people who have previously had COVID disease be vaccinated? And ACIP's recommendation is yes. People who previously had COVID disease should be vaccinated. However, vaccination can be delayed 90 days from your onset, and that's because the likelihood of reinfection is less within that 90-day time period, but there is a potential for reinfection after 90 days. And so there isn't a minimum interval between disease and vaccination, but it can be delayed for 90 days if people want to do that or if facilities want to make priority recommendations based on that information. The other recommendation was made that pregnant and breastfeeding women may be vaccinated. That was a group that we were unsure about if pregnant women should be vaccinated. And ACIP is stating that pregnant women may be vaccinated. Those women are at high risk for serious complications due to COVID disease and should consider vaccination based on their risk of disease and weigh that risk of disease with the risk of a potential side effect from the vaccine. And they're encouraged to speak with their healthcare provider if they have questions on COVID vaccination. So that's what I have to talk about on Pfizer's vaccine. And so that's the only vaccine that we currently have in North Dakota. But tomorrow, FDA's advisory committee, the Vaccine and Related Biological Products Advisory Committee, is meeting to discuss the Moderna vaccine. Yesterday, FDA released their clinical trial data. And again, very positive, very exciting, almost 95% efficacy for the Moderna vaccine as well, a positive safety profile. And just as a reminder, the Moderna vaccine comes in 100-dose increments as opposed to the 975 that comes with the Pfizer vaccine. And this vaccine requires normal frozen temperatures, not ultra cold, and has 30 days of refrigerator stability. North Dakota has already placed our order for the Moderna vaccine. We've ordered 13,200 doses of the Moderna vaccine in anticipation of the FDA authorization. And we're sending that to 157 different facilities across the state of North Dakota. And so there will be Moderna vaccine all across the state, a variety of different providers, including local public health, tribes, tribal health, and even some of our smaller independent clinics. In the clinical trial data, as I stated, it had a 94.5% efficacy. It had 100% efficacy against severe COVID disease. And it showed an 80.2% efficacy after even a single dose. Now, this vaccine, you still do need 2 doses, 28 days apart. However, it is promising that even after 1 dose, there may be some prevention of COVID disease. And Moderna was able to include some information that it may even cut asymptomatic cases by 2/3 after 1 dose. All vaccines do have some side effects, and for this vaccine, it was deemed safe. However, the most common side effects are injection site pain, fatigue, headache, and muscle pain. And so we are very excited to have this Moderna vaccine, and so we'll have 2 vaccines likely next week to fight COVID. I also want to mention long-term care facilities will likely start vaccinating the week of December 27th. As the governor said, they're a very high priority for vaccination. We want to get all residents and staff vaccinated as soon as possible, so that will likely occur the 27th. In terms of priority groups for vaccination, I was hoping I could come today and tell you subsequent priority groups beyond Phase 1A, which is healthcare workers and long-term care residents, but the ACIP did not discuss that last weekend, and they are discussing it this Saturday, the 20th. On the 20th, they'll be discussing subsequent priority groups for COVID vaccination, and so at this time, we still only officially have Phase 1A for priority groups. And then I just wanted to remind everyone that even after vaccinated, you still do need to take appropriate precautions, including wearing face coverings, social distancing, and if you're exposed, quarantining. And we hope in the future that eventually we'll be able to say you can take your mask off. We don't yet know that yet, but vaccination is likely the only path towards ever getting to the point where we can be done with some of the social mitigation measures. And then I just encourage people to go to our website and our social media pages for more information. So now I get to introduce some individuals who get to get vaccinated today, and I'm super jealous. I will get vaccinated as soon as my turn is up, which is not right now because I'm not a frontline healthcare worker or a long-term care resident. But I will get vaccinated as soon as I can. So I guess I'm happy to watch you, but I am kind of jealous that you get to get vaccinated today. But I'm going to introduce Alena Goergen. She's going to provide some comments and then be vaccinated. Alena is the Director of Nursing for Miller Pointe in Mandan. And while she's coming up here, I just want to thank CHI for bringing vaccine today and doing the vaccinations. This is Jordan. She'll be giving Alena her vaccine today. And when she does vaccinate, I want to point out, you're going to see she's not wearing gloves. And I saw there's been a lot of social media. Why aren't people wearing gloves? That's not a recommendation. OSHA, CDC do not recommend the use of gloves, and we want to save gloves for other healthcare workers that need them. So that is why Jordan will not be wearing gloves today. So, Alena?
Molly, you want to expand on that? They don't need gloves because there's no live virus?
Yes. So gloves are not needed because well, first it's passed through the respiratory route. It can also be passed through fomites, but not on your arm. But gloves are not needed because there's no exposure, there's no blood that's going to be coming out when she gets vaccinated, so there's no risk there. And she will be sanitizing her hands before and after giving the vaccination. So, Alena?
Good morning. Thank you, Governor Burgum and DOH for having me. A little bit about my story. I had an experience with COVID in early September. Through serial testing at my facility, I tested positive, asymptomatic at the time. The first 2 days of my experience being at home was very tolerable. I thought it was a traditional, regular winter cold. The next 4 days, I ran the gamut of the popular COVID symptoms: lethargy, fatigue, severe headache, cough, congestion, shortness of breath, body aches, fever, loss of taste and smell. Those 4 days were, albeit miserable, and I was relatively bedbound at that point. I did start to feel better once the headache subsided. It made it a little easier to get around and be more mobile. The headache for me was the worst symptom. It was the hardest part to recover from. Once the headache did go away, though, that did make it a little bit easier to move on. As far as recovery, I did end up with some pneumonia about day 12 or 13 that I did receive a course of treatment for. The fatigue and the cough, shortness of breath, took several weeks to go away. And even now, I don't feel like I have the stamina that I did pre-COVID. So working on that. In my experience in long-term care, COVID affects people so differently, and it's a very unpredictable manner in which it affects people. Everyone knows somebody who's had it and had no symptoms. I also have the unfortunate experience of knowing people who were not only hospitalized, but also succumbed to the fatality of COVID-19. So for me, having the opportunity to come to speak, to receive my vaccine, it's an invaluable experience for me. It is extremely risky to not know what variety of COVID you're going to get. And for me, I believe that the less people that ever have to experience it, the better we are. So that is part of why I decided to get vaccinated. I did my research, which I would expect everyone will do. Find as reputable sources as you can. Get your homework done. It is a personal choice. Being vaccinated is always a personal choice, but for me, I'm going to choose yes to be vaccinated. And much like working in healthcare, that choice is not going to be about me per se. That vaccination choice will be about the patients I care for, the staff I work alongside, and my family primarily. It's more about protecting everyone else than it is protecting me. I had it. I don't wish to have it again, but I'm here, luckily. So vaccine as a whole is what we have to hope on right now. The residents and staff in long-term care are tired. They're exhausted. And we know all too well how visitation limitations have affected the residents. But on the flip side of that, we also know how COVID-19 has affected some of the residents as well. So we're in a bit of a squeeze. And if this vaccine is our first step in the direction of, going back to a little bit of normalcy, I hope that that's what we can do. We've always wanted the residents in long-term care to be happy and safe, and COVID-19 has made both of those things very challenging for us. So the staff are working overtime to try to fill the void of the families, but I believe that something's got to give, and it's got to give for long-term care, for healthcare workers in general, for first responders, for schools, for small businesses, for sports, for the community. At this point, I don't know that we know exactly how vaccinating is going to change the PPE or the limitations on visitations in long-term care, but right now we are hopeful that we will have enough people vaccinated that we can start doing some of those things for the residents and for the staff. So I'm going to choose to be vaccinated for them.
We went through all her questions and everything prior to this, so we are good to go here.
Thank you, Alena. And I just want to thank Alena for everything she's doing in long-term care to protect her patients and all of her work, and all of the long-term care workers that have been working extra hard this year. So thank you. Next up, I'd like to invite Dr. Archuleta to this stage to be vaccinated. Dr. Laura Archuleta is a family physician at CHI St. Alexius, and she's also medical staff president, and she's going to talk about why she's getting vaccinated, and then we'll have an opportunity to see her get vaccinated.
Thank you, Molly, and thank you, Governor Burgum, for letting us have this opportunity today. First of all, I'm getting vaccinated because, like most of you, I don't have time to sit around for a week and a half in self-isolation waiting for this disease. I know statistically that if I were to get it, I'm probably going to be one of the less strongly affected ones, but I can't guarantee that my family and friends would be the same. So the more important reason that I'm getting vaccinated today is that I want to help protect them. I'm hoping that by getting the vaccine, it will reduce the results of me getting it and therefore spreading it on to other people. In our clinics and in our hospitals over the last few months, I've seen a huge variety in the severity of illness. We've had asymptomatic individuals, we've had some who have just mild cold symptoms, and then we've had those who didn't need to be hospitalized but still were stuck at home for 3 and 4 weeks, not able to get off the couch because of severe fatigue, shortness of breath, body aches. Finally, I have seen some who I thought would do well but ended up on ventilators for several weeks. Some of them were fortunate enough to survive, some of them were not. I do think that this vaccine is safe. In fact, I know, based on the research that I have done, that it is safe. However, I also know that it's possible that we will see new side effects come up after the vaccine is released. Given the size of those phase 3 trials, I think any of those events are going to be very rare, probably less than 1 in 100,000. So given that the rate of death from COVID in North Dakota is 1 in 152, I am confident that the risk of the vaccine is far less than any risk of the virus itself. I think, for me, the vaccine is starting to give us some hope. I seriously got chills when Alena got her vaccine. This has been a very dark, depressing, hopeless time for many of my friends in the healthcare field. I've seen renewed energy and excitement in them over the last couple of weeks, knowing that this vaccine is coming. This is the encouragement that we need to know that there is a light coming at the end of the tunnel. The biggest concern that I have heard about the vaccine from my patients, the biggest question I keep getting asked is, how can a vaccine that was developed so quickly actually be safe? And I just want to reiterate what the governor said. The medical community is absolutely behind this vaccine. To me, this shows what the scientific community can do when they have the resources that they need. They did not cut corners when it came to the quality of the studies themselves. What they did was they got rid of the red tape, they streamlined the processes, and they started the production so much more efficiently and so much more quickly than they've ever been able to do before. To me, this is a major win for our scientific community and for our patients. I can honestly tell you that I have never been excited to get a vaccine before, but I am today. Thank you.
And just thank you to Dr. Archuleta, thank you to CHI St. Alexius, Jordan, for being here today to administer the vaccine, and thank you to all of our medical providers who are soon going to be very busy giving lots and lots of vaccinations, hopefully. So thank you.
I want to say thanks to Alena and thanks to Dr. Archuleta for sharing their powerful stories about the why behind why they're getting the vaccine. As you heard from both of them, it's not just about themselves, it's about protecting those people around them and the patients that they serve. And I think this is reflective of all the heroes that we've had on the front line in North Dakota who've been making these sacrifices this last year to serve patients in the face of this deadly disease without any protection from a vaccine. So, of course, this is a point of celebration and optimism for everybody in the healthcare community. Molly, I want to thank you for all your work and your leadership. I want to thank Dr. Archuleta and Alena for sharing their story, but I also want to challenge everybody in North Dakota, and particularly those that are working in healthcare directly with COVID patients and those that work in long-term care. You saw the numbers. It's exciting that we've received over 6,800 doses of Pfizer, and it's exciting that we've got hundreds of those already administered. What would be more exciting if we just stood here today and say we've received 6,800 doses and we've given 6,800 vaccines. And so I want to again encourage everybody who's involved in this process. It's not victory for us to receive the vaccine in North Dakota. It's only success in breaking the chain of transmission and protecting our most vulnerable when we actually can deliver it. And as you heard from Molly, well, both of these, Pfizer and Moderna, both have require 2 doses over a period of time. There is substantial protection that afforded from the first vaccine. So us rapidly getting those first doses out to individuals, that'll take pressure off us 3 and 4 weeks from now when even more is arriving and we're trying to deal with first-time doses and second-time doses. So logistically, it's, there's a saying in Olympic sailing, which says you never have to recover from a good start. And we have an opportunity to get off to a great start in the coming weeks. So again, I want to thank everybody, including today, CHI St. Alexius, who was here helping today, but everybody who's helping get the vaccine delivered to individuals is doing a great service. And so again, I challenge everybody who's eligible to get vaccinated, please do, and please so quickly. You should know that we do have calls coming in every day to the health department, the governor's office, people that are sort of begging to be at the front of the line, and we have to tell them no. They have to wait down the priority. Americans aren't used to rationing, but when we're in this situation and we have available doses, let's put them to use and start saving lives right now. And again, when I think with Alena talking about the challenges that she's faced in long-term care, and as I spoke about earlier about the majority of those who who have passed have been in long-term care. It's more important than ever that we get vaccinations completed among both residents and staff in long-term care, because that is the path towards taking care of both their health and their happiness and reopening visitation. So we have path forward here with that. And one other way that we can have a path forward is through rapid testing, people knowing their status, and this can help on everything from keeping essential workers working, keeping kids in school, and it can help us even with long-term care visitation. And so we have to use all of our tools. On November 22nd, we announced a pilot project to roll out Binax Now rapid tests for teachers, staff, and administrators in 3 school districts. That was right before Thanksgiving. We now have over 30 schools that are signing up to take advantage of this, as well as many private sector businesses. There was one that was featured yesterday in the Bismarck Tribune, where businesses have been reaching out to take advantage of this to test their essential workers. And again, we're continue to work. I would ask people to stay posted because there'll be announcements coming in the coming days as we head into the weekend and the holiday season here to try to make Binax Now rapid testing for free available at locations that even help consumers as they may be thinking about going about their preparations for Christmas. So think of these as us trying to even set up more retail type locations. But one of the most exciting uptakes for the tests that we have on hand is being planned at the University of North Dakota. And here electronically, we're going to tie into Dr. Josh Wynne, who's the Dean of the UND Medical School and Health Sciences and our state's Chief Health Strategist, been a key player advising the health department and our office. During this time, I see that Dr. Wynne's up on the screen, but Dr. Wynne, take it away and talk about how we're going to use this to keep our universities open.
Well, thanks very much, Governor Burgum, and good afternoon, everyone. So I'm going to switch to the professor mode for just a second to actually mention what antigen testing is. As the governor has mentioned, the standard that we've used is called PCR, or polymerase chain reaction testing, and this involves a specimen from the upper airways. And we're actually looking for the genetic code, and when it's detected, that's a positive test. Antigen testing, on the other hand, looks for some of the protein material in the virus and thus can identify it. And antigen testing has several advantages over the standard PCR testing. They've been mentioned by the governor, and they include: 1, much less expensive, so order of magnitude $5 versus $125, meaning we can do it in a much more widespread manner. 2, quick. A result is typically available in 15 minutes rather than a day or more in some cases with PCR testing. And 3, antigen testing is what we call point of care. That is, we can bring the test to the individual rather than having the individual going to the test. So because of those 3 advantages, we plan at the University of North Dakota to augment the routine testing we're doing now with PCR with fairly extensive testing using this new antigen test. And we hope to offer it to both faculty, staff, and students for everyone who is on the UND campus in Grand Forks, and to do it on a repetitive basis. So why do we want to do this? Why do we want to add this to PCR testing? Quite simply because we can test many more people that way. There's a limit to how much PCR testing we can do. And as you know, North Dakota is among the leaders in the nation with the amount of PCR testing that we do. But this can increase that amount of testing even further. And that's why we're excited about this at the University of North Dakota and other institutions within the North Dakota University system. What we hope is that by doing this in a widespread and frequent manner, that we can identify even more asymptomatic individuals, do the appropriate isolation and contact tracing then, and really continue the direction that the curves are going that the governor talked about earlier, which are headed in the right direction. We hope to have this instituted when everyone returns to campus after the holidays, because we are a little concerned that we're going to see an uptick after the holiday break as people come back from various locations. So we are hoping that this additional testing will really help us to keep any new cases under control so that we can continue the positive course we're on. I would end with two requests, and then I'll turn it back over to the governor. The first is that continue, my fellow North Dakotans, to doing the good things that you're doing now over the holiday break. We want the curves to continue to come down. And the second is, when your turn comes, please get the vaccine if you don't have a contraindication. It's really the definitive way that we will bring a resounding end to this pandemic. So please do those two things. Continue to keep your guard up over the holidays and do all of the things you're doing now to limit the spread of the virus, and get vaccinated when your turn comes. Thank you, Governor, and thank you for letting me address the group.
Thank you, Dr. Wynne. Thanks for your leadership and across the whole university system, as well as your work advising the whole effort. As Dr. Wynne said, there are many advantages that we have to understand that are available through the rapid testing. One obvious one is cost. When you got a 25-to-1 cost advantage, we can do 25 times as much testing for the same result. The second is the speed. When we're talking 15 minutes versus days, that can help us break the chain of transmission. And again, the Binax Now test highly effective at detecting people who are infectious right now and getting them out of the transmission chain. So there's great advantages to this tool in terms of cost, in terms of speed, in terms of efficacy, and deploying this thing as a surveillance tool is going to help us really. We've got the numbers headed in the right direction, but if we want to run this to the ground, this will be one of the tools. There are universities in the northeastern part of the United States that have been doing what Dr. Wynne described, which is testing regularly all of students, faculty, and staff. And those groups that have been doing that are seeing as low as a 1% infection rate, because when someone is positive, they get isolated, they can't spread it to others, and then everybody else can keep going to class, doing whatever. And it is really a highly effective tool. And so we want to be among the leaders as a state in deploying this and a tool to help us in parallel with the vaccine, in parallel with the mitigation, in parallel with the therapeutics. These tools are going to, on this three-pronged attack, are going to really help us take this thing to the finish line. And as I said at the beginning, our third tool in the tool chest that we've got more capabilities is therapeutics. And you've heard some of these names talked about, whether it's remdesivir, convalescent plasma, or monoclonal antibodies. These treatments are showing incredible promise in keeping COVID-positive individuals not only alive, but to keep them out of the hospital, which is a key thing that we're trying to do. As a state, we'd like to see increased usage and administration of these treatments. We're going to continue to advocate with the federal government in terms of reimbursement. In the call we had with the White House on Monday in Seema Verma, this concept of being able to reimburse hospitals for delivering services outside the hospital walls. Think about that as how can we, with like mobile infusion units, get these life-saving tools to people before they get in the hospital, but the hospitals and those that are presenting them can get reimbursed. So we're, again, trying to work through that red tape. We've seen success in Minnesota with monoclonal antibodies being delivered to patients in long-term care facilities, and only a small percentage of them end up in the hospitals. But the key is getting them to people early in their cycle as appropriate. But here to share more about the promise and the potential of these therapies therapies is Dr. Joan Connell. Been a regular presenter at our press briefings. Great to have you back, Dr. Connell, and she's the Field Medical Officer for the Department of Health and the leader of our North Dakota Physician Advisory Group. Dr. Connell.
Thank you so much, Governor Burgum. And I just have to say, watching my colleagues get vaccinated made my heart thump like watching my kid at her national synchro skating competition and my son at his big championship for soccer. So way to go, team. Today, I would like to share some modalities for treatment of COVID-19 disease that are geared toward keeping high-risk patients from getting sick to the point of requiring hospitalization. To begin with, I would like to tell you a bit about monoclonal antibody therapy that is now available for North Dakotans at risk for severe disease from COVID-19. Typically, there's a part of the virus that connects with our human cells, sort of like a key in a lock to open the door to our cells. Monoclonal antibodies work by binding to that key part of the virus so that the key can't ever reach the lock on the cell. This prevents entry of the viral RNA into the cell, which then stops the replication of the virus within your own body. This medication is reserved for high-risk patients who have just recently developed symptoms of COVID-19 and or for those high-risk patients who tested positive and have not yet developed symptoms, again with the goal of preventing serious disease. Currently, the FDA has made the monoclonal antibody therapies bamlanivimab and Regeneron available for recently diagnosed outpatients at high risk for developing severe COVID-19. While monoclonal antibody therapy is authorized for outpatient use, medications that have been reserved for patients hospitalized with COVID may also work in conjunction with monoclonal antibody therapy to reduce risk for severe COVID disease. As you know, the antiviral medication remdesivir and convalescent plasma have been mainstays of therapy for our hospitalized patients. Like monoclonal antibody therapy just discussed, remdesivir works to end the replication process of the virus, but in a different way. Convalescent plasma works by providing the antibodies that someone before you made to fight their own COVID-19 infection to assist your immune system in fighting your infection. Given how each of these treatments works to stop replication of the virus, it makes sense to provide these treatments to high-risk patients very early in their infectious process, before virus has had time to set up shop in the body and cause damage. Currently, the FDA has authorized the use of remdesivir in convalescent plasma in hospitalized patients only. Given the potential benefits of providing these treatments to patients shortly after diagnosis, we are very appreciative to the governor for working closely with our federal partners to make these treatments available to our North Dakotans at high risk for severe disease from COVID. In anticipation of this authorization, we're also working closely with our state physician and healthcare facility partners to make sure protocols for outpatient use of these treatments can be put into place upon approval for outpatient use. We'll keep you posted on that process. Additionally, I want to remind you that dexamethasone, a prescription medication that has been available for decades, has been shown to be very effective in reducing the severity of COVID-19 disease. Finally, I would also like to inform you about the availability of outpatient monitoring programs in some of our communities that have been put into place to make it possible to safely discharge patients home from the hospital sooner, while still being able to make sure they're recovering safely at home, as well as to monitor high-risk patients at the time of diagnosis to make sure they're safe out of the hospital. So, how does one access these therapies and programs? The North Dakota Department of Health encourages those testing positive for COVID-19 to talk with their primary care providers about their risk for serious disease from COVID-19, as well as whether they might be candidates for any of these therapies or monitoring programs that we discussed. If you have a family member who resides in a long-term care facility, make sure they have considered the options for treatment in and out of the hospital and have a plan in place with their long-term care facility and their healthcare provider. And remember, utilization of all of these treatments will be much less necessary if we continue to practice the common sense mitigation strategies of good hygiene, mask use, and social distancing. I want to personally thank the governor for those making that more possible and making it have a bigger uptake. And I want to thank you for your time in allowing me to share this information with you.
Thank you, Dr. Connell. And again, as Dr. Connell said, a variety of therapeutics available now, but the key is getting them early in the cycle. And so again, talk to your if you or a family member gets infected and you're saying, hey, well, I feel pretty good, that's great. But that may also be the time to call your physician and see if you're eligible for the therapeutics. We have these available. These were also rationed early on in the pandemic, and there wasn't enough. But we do have supplies of all these therapeutics here in North Dakota. So again, we want to get them off the shelf and use them to save lives. We know that we know that where they have been used, we've seen a drop in mortality. And again, if you are wondering about family members or yourself, again, a lot of reliable sources online, but typical underlying health conditions that may cause you to be deemed eligible for the use of the therapeutics early in your cycle could include prior lung disease, prior heart disease, obesity, and age, and if I said diabetes, I'll say it again. But those are all factors that could go into a consideration that would create eligibility for you. And again, reduce your severity of your disease, keep you out of the hospital, and keep you alive. So make that call to your physician to find out if these are appropriate for you. Thank you, Dr. Connell, for walking us through those and sharing those slides. As we move towards the end here today, behavioral health update again, which we know is key. The behavioral health team is offering some new holiday-focused resources for parents and family members because we know that the holidays may be different this year, but just because they're different doesn't mean they can't be fun and memorable and creative. And so the resources that are out there on parentslead.org talk about creative ideas on how to create new family traditions that will last beyond the pandemic, connecting with loved ones while social distancing, conversation starters to help adults talk with children about safe and practical expectations around holiday activities. And then a 30-day calendar is also available with ideas and activities that a family can do together across the holidays. So again, the more information out at parentslead.org, and throughout December, holiday parenting information will be shared both on Parents Lead and on the Department of Health social media channels. In closing with our gratitude quota today, one of the most watched individuals on TEDx, Brene Brown, who's an American professor and author, made the statement that said, "We are a nation hungry for more joy. And we're hungry for more joy because we're starving from a lack of gratitude." The good news is that when you're starving from some things, you've got to go find it someplace else. But gratitude, you can grow in your own personal garden. If you got think about having an empty bucket next to you, and you reach in and pull some gratitude out of it. But that bucket is full. After you pull out the gratitude, it'll still be full because it is an abundant, ever-filling resource. It's just up to you to exercise that. So as we head into the holidays, which is a season of joy and a season of gratitude, I think there's so many things we can be grateful for. All of the scientific minds that created these therapeutics, for all of our frontline healthcare workers. We can be grateful for the enormous energy and speed at which the vaccine, this is really the equivalent. This is, in World War II, it used to take, at one time it took 3 months to build a plane, and then by the end they were building them in 3 days. Our nation can do incredible things. We've shown that here with the vaccine. And so again, that's something we can be grateful for. And again, for the innovation that went into a rapid test that is being provided to the state of North Dakota for free by the federal government is something we should all, it takes 15 minutes of your time to know your status. And with that, you might be able to, save lives and save livelihoods over the holidays and put us in a position to have an absolutely great start for 2021. So with that, we'll stand for questions. And I would want to remind people that Molly Howell on vaccines, Dr. Connell on therapeutics, Dr. Wynne, I'm sure, is still on the line. All are available to answer questions. I'm going to, usually Jacob's in the back here on the side. This time we're going to start with you, sir.
Governor, I'm wondering what communication has been like with the tribes when discussing the vaccine rollout plan.
Well, Molly can jump in if needed, but there was an opt-in for the tribes to choose to go either through the Indian Health Service or to work with the state of North Dakota. Two of the tribes chose to work with the state of North Dakota, and that was the Mandan, Hidatsa, Rikar, MHA Nation, and Spirit Lake chose to work with North Dakota. Our other three with which we share borders, including Standing Rock Sioux, Turtle Mountain Band of Chippewa, and Sistanoyate, all chose to go through Indian Health Services. So they're receiving allocations through IHS, and then we're working with the tribes on the allocations here. And we're going to continue to reach out to even those that worked through Indian Health System, because they're our partners, they're neighbors, they're our North Dakotans, to make sure, because if there's any issues there, we know that there's a lot of people that would qualify for the, when we get to the point of vulnerable populations, we're not there yet. The priorities, here that we talked about for frontline healthcare workers and long-term care is first priority, but we're going to continue to collaborate. Molly, anything you want to add to that, or she's giving me a thumbs up? Okay, Jack?
The Vaccine Ethics Committee on Monday recommended that older adults, people in congregate living settings, and those with underlying conditions be prioritized in the second phase. When will the state's COVID Unified Command and the governor's office sign off on that?
Molly, do you want to come up and talk more broadly about the process and where we are? And maybe first off, since I know you have worked nationally, contributing to national boards, but maybe share with the team what the acronym ACIP is, so they all know that for their reports.
Sure. So in terms of priorities, the Federal Advisory Committee on Immunization Practices will make recommendations as to how COVID-19 should be prioritized. And so, as discussed, they've only so far voted on Phase 1A, which is healthcare workers and long-term care residents. North Dakota, because we knew we wouldn't have enough vaccine for everybody in all the priority groups, set up a North Dakota COVID Vaccination Ethics Committee made up of 5 individuals who have been meeting weekly to prioritize within the ACIP priority groups. And so that's where our tiers for Phase 1A that are on our website came from. So you're correct, on Monday, that group did vote to recommend older individuals, people with underlying health conditions, or others that are living in congregate settings like homeless, corrections, be prioritized in Phase 1B for vaccination. And so that's currently under review at the Health Department with Unified Command. But we do know ACIP on the 20th will likely make their recommendation for who should be in Phase 1B. And so we kind of do want to see, what ACIP is going to recommend and what their data is and their basis for their recommendation. And then we'll have to make a determination as a state, because it is still up to the states. ACIP is just a recommendation. Having said that, in talking about the tribes, I do want to let people know the tribes will have sovereignty to make their own determinations for priorities as well. And so they may decide the tribes might be on a different priority group than the rest of the state is on, and that is completely up to the tribes to make that decision, as long as it's in the spirit of the ACIP recommendations. Okay, do you want me to? Okay, Morgan.
Just going off of priority groups a little bit, are there plans in place to ensure that those recommendations for the priority groups are followed, or are kind of hospitals, once they get their vaccines, under their own discretion?
So I don't know if everyone heard Morgan's question. She's asking if there are plans in place for us to make sure people are following our priority groups or that providers are. I mean, we will definitely hear, I'm sure, from people if they're going outside of the priority groups, and we will address that. And it could potentially impact subsequent allocations if it's completely, something unethical. But I don't see our providers doing anything like that. They want guidance for priority groups. That's why we have an independent committee that's basing it on ethical decisions. They want some of that guidance. But once it's in providers' hands, it's up to them to prioritize. Also, these aren't black and white. Like, we have 5 tiers for phase 1A. Some providers, depending on uptake, might be in tier 1 and just vaccinating tier 1. Other providers might be vaccinating tiers 1 through 3. And so it is going to vary across the state, and we're going to have to adjust allocations as we go based on uptake in different areas and how many healthcare workers are in different areas and residents. So, Jeremy?
Molly, I know you had an estimate last week of about 40,000 doses that would come into the state before the end of the year. I'm wondering, is that number still what we're looking at here, and is there an estimate for when all residents of long-term care will be vaccinated?
So the estimates are just that, they're estimates. The only confirmed allocations that we have are the 6,825 Pfizer doses we received this week, and the 13,200 Moderna doses that we're anticipating to receive next week if authorized. From this point forward, we will receive weekly allocations. The current plan is that we will not receive our official allocation until Friday, the week before the following week when the vaccine could ship. And so, today's Thursday. Tomorrow, we'll know how many Pfizer doses we'll have for next week, if that makes sense, additional doses. And so we do have rough estimates, and so we're using those for planning purposes, and we are still being told it should be around 40,000 doses, but it's definitely not a firm estimate. In terms of long-term cares had different options for vaccination, and so some could go through the Federal Pharmacy Partnership Program, which is the CVS and Thrifty White program. They will be starting vaccinations on the week of December 27th, and we have been told that they will be able to complete the initial rounds of vaccination of all the long-term cares that signed up within 3 weeks. And then they will go back to those long-term cares a total of 3 times. And so they'll go once, and then they'll go again, if it's Pfizer vaccine, 3 weeks later to give people second doses. And then if people were missed in the first round, they can give them first doses. And then they'll go back one more time to vaccinate in case anyone needs second doses again. Some long-term cares signed up to be vaccinated by local public health, another independent pharmacy, or to vaccinate themselves. They will be allocated vaccine the week of the 27th, and so it's up to them to schedule those clinics and get necessary consents and everything like that. But that should be done fairly quickly as well. Online?
Scott Hennon, WZFG KFYR Radio. Do we know how long the vaccine is effective for?
That's a good question, and the answer is no. We have at least 2 months of data that the vaccine is very effective after 2 months, or that people have a prolonged immune response for 2 months. That's how much data we have. They're not seeing declines in antibodies after vaccination yet, even at 2 months out. So I think it's promising for long-term immunity, but no, we will not have that data until we're further out from when people in the clinical trial initially received their vaccine. Jack?
Is it too early, Molly, to say what form vaccinations will take for the general public? With our testing campaign that's been drive-in vehicles, and you mentioned the polio vaccine, and back in those days we vaccinated tens of thousands of people a day. Do we know what shape or form or numbers our COVID vaccinations will take?
We're planning for COVID vaccinations to look similar to flu vaccine. We want people to be able to be vaccinated wherever they're normally vaccinated and in the most convenient way possible, whether that's going to a pharmacy, going to a clinic, going to a mass vaccination clinic at local public health, or even potentially in your workplace. A lot of workplaces have vaccination clinics. And so I do think that will happen. A lot of it will be dependent on how many doses we have, how much vaccine, which vaccine. The Pfizer, we've talked about the limitations that we've had in the past with the ultra cold chain. But I do think it'll look similar to flu vaccine, and we have calculated out during the last flu season, the highest number of doses that were administered per week in North Dakota was about 45,000 doses last year. And so we can at least administer as a state 45,000 doses of COVID vaccine. And that was without any additional ramping up or any additional teams for vaccination. That was just a normal flu season.
45,000 flu doses in 1 week.
Correct, yes. Any other vaccine?
We'll beat that.
What?
We'll beat that.
Oh, we're going to beat that. So, yeah. Any other questions? I hope we have that much vaccine that we can do 45,000 doses in a week. That would be amazing. So that might be the rate limiting step. Any other questions? Okay.
Thanks, Molly. Next questions? We'll go online and then go to Jeremy.
Mike Smith, 660 KUIZ in Williston. Do you have any comment about the rooftop bar in Bismarck staying open past the mandated hour ending? And are you worried of other businesses following suit, especially for New Year's?
Don't have any comment on that. I'll leave that to local officials. But I would say with the heading into the holidays, of course, as you heard from the medical professionals here, we're worried about all gatherings, whether they're in public establishments, public places, or in homes, because transmission can occur any place. And I think that we know that traditionally in North Dakota, as North Dakotans, we gather for holidays, and we gather in large family groups, and we gather in multi-generational family groups. This is the time when a lot of times kids coming home from college, they may have had a lot of exposure. Hey, we're going to see our grandparents. At Thanksgiving, we saw North Dakotans change and take different approaches, and I think that the results of that are shown in the decline that's here. And so as we head into the holidays, again, we want, as you've heard from everyone here, to let's keep the success going that we're having by being smart this Christmas. This isn't a forever thing. This isn't change, for the rest of your life. This is change this Christmas. You just heard here that we could have, by the middle or end of January, we may have the potential to have vaccinated at least the first dose of all long-term care individuals. We've got an opportunity with the surveillance testing to really be able to break the chain of transmission like never before with rapid tests. And we've got, with broader use of the therapeutics, we have a chance to actually bring the mortality rate down of this and free up hospital capacity. So we're at the cusp of, we've got good numbers. We're at the cusp of a breakthrough, and we don't want to go backwards. So this, again, the biggest tool we have until these three new tools take into effect and really gain traction, the vaccine, the rapid testing, the therapeutics, the biggest tool we have is the choices that individuals make. And individuals have made great choices in the last weeks over the holidays, and so over Thanksgiving, and everybody was worried that we're going to have a post-Thanksgiving bump. We didn't. We've gone the other way, and we'd like to see that over the holidays. So again, we would just encourage people, again, really pay attention about the availability of rapid testing in your community. Know your status, particularly if you're going to have, if you're going to see anybody that's been outside of your core group. There's just real value in knowing your status so that you're not unknowingly infecting someone where this could be a very serious or fatal illness for them. So I'd say that. And then again, we did extend some of the orders into January, but the kinds of trend lines we're seeing and if we get uptake on vaccine, we get uptake on therapeutics, we get uptake on the Binex testing. If those things are all gaining traction, that allows us to think perhaps more broadly or sooner about lowering some of the mitigation strategies on businesses. It doesn't change everybody's individual responsibility, but those things things all go together, because we're managing a multiple set of variables here. And so again, the path towards the path towards us getting, quote, back to normal is people actually taking action as we have been, personal responsibility, and then seeing uptake on the testing, the therapeutics, and the vaccine. If we got vaccine and there's no uptake on it, then we're in for a much longer haul on the mitigation. But if people don't like the mitigation measures, then get in line and get your vaccine, because that's one of the ways. And if you don't like the mitigation measures, then get yourself tested, because if everybody who's positive takes themselves out of the transmission change, that reduces the need for the mitigation. And if everybody's worried about, thinks this thing is not something to worry about, listen to the people who've had the disease. And if you're positive and you're vulnerable, get in contact with your physician and get on the therapeutics early and save yourself a hospital visit or even the agony of a fatal outcome. So that's again, North Dakotans can change the path we're on, and they're changing it right now. So individual responsibility is still key to the messaging. Okay, Jeremy?
Governor, you mentioned earlier we've seen active cases decline pretty precipitously. We've seen hospitalizations today take a big drop. However, the rate of deaths really hasn't changed that much since November. I'm wondering when you would expect that to come down.
Well, we know that hospitalizations follow cases and deaths follow hospitalizations in terms of lagging indicators. So with hospitalizations going down, we all pray that the deaths will also follow. But the thing that I want to really stress here is that there is life-saving therapeutics that are out there. So if you are vulnerable and elderly and test positive and feel okay, that's the time to call the doctor and say, should I be getting on these therapeutics, one or the other, or combination? Because that could save your life. That call could save your life, and it could also definitely save hospitalization. I mean, the dramatic decrease in hospitalization need for people that get on monoclonal antibodies early, there'll be some studies coming out shortly, but it is it's remarkable. So that's our hope there. So that's still a battlefront that we have, Jeremy, is too many people are dying, and we've got to continue to work to solve that. Okay, one more online, and then this wraps it up.
This will be for Dr. Connell.
Great, thank you. As Dr. Connell's coming up, we've got a bigger, deeper room here, and I can't tell exactly what sports gear Lane's wearing today, but I do believe there's a bison on it, and even though it may not be the right colors, I'm going to chalk that up that he's not wearing somebody else's logo today. But anyway, thank you.
Just the North Dakota sweatshirt.
Yeah, generic bison.
Just.
CRISPR Point of View Values Live. Is North Dakota using ivermectin as a therapeutic for COVID-19 patients, or as a prophylactic? If not, why not?
So that's interesting. That has come up with our physician advisory group. And the infectious disease physicians around the state uniformly feel that unless there are placebo-controlled trials for the treatment agents, they're not going to be incorporating them. And ivermectin does not have placebo-controlled trials. And so I dug into the literature a little further, just because there was one provider particularly who is really a believer. So I guess it depends upon where you go whether ivermectin is being used, because there's one person in the state who I think is a fan. But when I looked at the literature, and this is the difficulty of assessing scientific literature, is it's sort of built on a hierarchy, and that tip of the iceberg is the placebo-controlled randomized trial. And then at the bottom is anecdotal reports or a case report. So a lot of the ivermectin information I found once I went looking for it was from journals that are not peer-reviewed and studies that have conclusions that say this looks promising in our small set of patients and merits more study. I wanted to know if you wanted me to read the who's considered a high-risk patient while I'm here, because I do have that whole list. Okay, so have a body mass index greater than or equal to 35. So that's between obesity and morbid obesity. Have chronic kidney disease, have diabetes, immunosuppressive disease, currently receiving immunosuppressive treatment, at least 65 years of age, or at least 55 years of age, and have cardiovascular disease or hypertension or COPD or another chronic respiratory disease. Now, if you're 12 to 17, you could be a candidate as well. If you have a BMI that's at least the 85th percentile for your age and gender based on a CDC growth chart. If you have sickle cell disease, congenital or acquired heart disease, a neurodevelopmental disease like cerebral palsy, a medical-related technologic dependence like a tracheostomy or a gastrostomy or require positive pressure ventilation. If you have asthma, reactive airways, or another chronic respiratory disease that requires a daily control or medication. So those are the list. And note for monoclonal antibody treatment, that is not indicated if you are hospitalized. So you really want to get these treatments early.
Thank you, Dr. Connell. In closing, I just want to say again, as we head into 2021 and through the holiday season, goals for 2021, we want to get all of our kids back in in-person learning. So I want to give a special shout out. I mentioned early on, we have 30 schools that are signed up for the rapid testing for the staff, administration, and the teachers. So in the school testing, we're not testing K-12 students, we're testing the adults in those environments and protecting those essential workers. And that testing would occur, those that have signed up will get tested once a week with the rapid testing. And this kind of surveillance testing is what's going to allow us to keep going with sports. It's going to allow us to keep kids learning in person. It's going to be a big tool. So thanks for those schools that are doing that. But we would really like to see we'd like to see every school in the state, K-12, at least making an active decision or inquiring about the availability for doing regular testing of teachers and staff, and particularly as we try to get all of our kids back in in-school learning. Another objective, of course, is we want to get back towards not just protecting the health of our long-term care residents, but also working on their happiness, and that means visitation. And so again, if we can get every long-term health care worker vaccinated, we get every resident vaccinated, and we've got tests available for visitors, we can start opening the door on that. So some of these big challenges that we've been working on are when we talk about new tools in the toolkit, we've got things that can work against some of our next biggest problems. And of course, again, as we've noted today, too many people are still passing away with COVID. And so again, the medical community getting behind what Dr. Connell talked about here and making sure that we can reduce hospitalization, reduce deaths with the use of the therapeutics. And then again, the challenge to everybody is we do not want as a state see a gap between the number of people who've received the vaccine and the number of doses we have in our state. Having doses in the state does nothing for us. Getting people vaccinated, particularly those that are on the front lines and working with patients or people that are at high risk, is an essential piece of what we have to do right now. That frees up logistic capacity a month from now when the second doses come in. And so you're doing a service for yourself, your family, your team, your community, your health organization, and everybody you work with by getting vaccinated. So thanks again to Alena, Dr. Archuleta, who got vaccinated here today. Thanks, Dr. Wynne, for your work on driving the not just K-12, but the NDoH, the entire university system, towards more in-depth testing. These things are going to allow us to have in-person learning at our universities, in-person learning in K-12, and healthy, safe visitation in our long-term care. And it's going to allow us to move beyond these mitigation restrictions. So again, thanks to all in the business community who are making choices and sacrifices to help us to slow the spread. And our team is going to continue to stay focused on the data and look for opportunities to move us forward more quickly if we see uptake on these 3 new approaches. So with that, that's our path towards victory. Thanks, everybody. Keep up the great work, North Dakota, and have a great Christmas holiday next week.